Today we are going to discuss about the bones of the lower limb. The bones of the lower limb are a hip bone, femur, tibia, fibula, tarsals, metatarsals, and phalanges. We are going to see the hip bone. Hip bone is otherwise called the innominate bone because it doesn't have any particular name. This is a hip bone. Hip bone from two sides articulates together in the midline anteriorly, and that forms a pubic symphysis joint. On the posterior aspect, each hip bone articulates with the sacral bone, and this joint forms sacroiliac joint. The widest part of the hip bone is called the ilium. This is the ilium. Then the part which comes in the front is called pubis, and the part which is present behind is the ischium. So the main three parts of hip bone are the ilium, ischium, and pubis. Each has its own significance. All these three parts fuse together at the level of acetabulum. So acetabulum is a socket-like part to which the head of the femur articulates to form the hip joint. You can see here the three parts in three different colors. This is ilium. The part which is given in blue color is the ischium. The part which is given in pink color is the pubis. So these three joints at a Y-shaped line at the acetabula. Now we'll see the parts of hip bone. Hip bone has three parts. Out of which the largest part is the ilium. Ilium has an upper border called iliac crest. This is a iliac crest. The iliac crest consists of an outer lip, an intermediate area, and an inner lip. Outer lip is this, intermediate area is this, and this is the inner lip. These areas gives attachment for some muscles. We'll see what are the muscles of iliac crest. Before that, see the end of the iliac crest anteriorly consists of a tubercle-like structure called anterior superior iliac spine, as well as posteriorly this iliac crest ends in another tubercle called posterior superior iliac spine. Here comes the posterior superior iliac spine, and here comes the anterior superior iliac spine. So we can say iliac crest is present between the anterior and posterior superior iliac spines. The muscles which is attached to the iliac crest are to the outer lip, external oblique abdominis muscle, intermediate area, internal oblique abdominis muscle, inner lip gives attachment for the transversus abdominis muscle. All the three muscles are abdominal muscles which is present on the anterior wall of the abdomen, external oblique, internal oblique, and transversus abdominis. The posterior part of the iliac crest gives attachment for the gluteus maximus to the outer lip and erector spinae to the inner lip. So here comes two muscles. Outer lip gives origin for the gluteus maximus, and here is the erector spinae muscle. Now we'll see the two surfaces of the ilium. Apart from having this upper border, the iliac crest, this also consists of an external surface and an internal surface. This is the external surface. In this picture also it is given the external surface of the ilium. This is the internal surface. If you are taking the individual bone, we can see this hole is the internal surface, and this is the external surface. The internal surface consists of a large depressed part. This is a depressed part present in the internal surface, which is called iliac fossa. Iliac fossa. The iliac fossa gives origin for iliacus muscle. The muscle which is present here is the iliacus muscle. Now, the posterior part of the iliac fossa consists of a roughened area. This area is a roughened part to which the sacrum articulates. To the upper part of the roughened area, sacral bone articulates, and in the lower part there is another pinna shaped structure which is rough, and this is called the auricle. This auricle shaped structure, and here is the articulation of sacrum, and that forms a sacroiliac joint. This is the iliac tuberosity. This pinna shaped area is called iliac tuberosity, that gives attachment for a ligament, the sacroiliac ligament. Now, if you are taking the posterior surface of the ilium, it consists of three gluteal lines. One is this, other is this, and the last one comes here. So these gluteal lines are fine ridges. It is not that visible there. They are small ridges. It is you can identify, but this is a posterior gluteal line. This going the anterior gluteal line, and here comes the inferior gluteal line. The gluteal lines are for the attachment of the gluteus muscles. The three main gluteus muscles are the gluteus maximus, gluteus medius, and gluteus minimus. Here, the part behind the posterior gluteal line gives attachment for gluteus maximus. Part between posterior gluteal line and anterior gluteal line gives attachment for gluteus medius. Part between anterior gluteal line and inferior gluteal line gives attachment for gluteus minimus. So, if you are writing here, I'll draw here. This is a posterior gluteal line. Here comes the anterior gluteal line, and here comes inferior gluteal line. And see, what about the muscles? The part behind the posterior gluteal line gives origin for gluteus maximus. Part between posterior gluteal line and anterior gluteal line gives origin for gluteus medius. Part between anterior gluteal line and inferior gluteal line gives origin for gluteus minimus. So, three gluteus muscles are attached to the gluteal surface. So, the anterior surface is called iliac surface, posterior surface is called gluteal surface. Now, we will see the ischium. Here it is given in purple color. This is the ischium. Ischium consists of a tuberosity like area, that is a roughened area called ischial tuberosity. This is ischial tuberosity. Ischial tuberosity gives attachment for hamstring muscles, that is the muscles of the back of thigh. Hamstring muscles are the muscles of back of the thigh or posterior compartment of the thigh. So this is giving attachment for hamstring muscles. Ischial tuberosity gives attachment for hamstring muscles. It apart from the hamstring muscles, apart from having this ischial tuberosity, the ischium also consists of a superior ramus and an inferior ramus. This is superior ramus, this is inferior ramus. And this projection is called ischial spine. This is the ischial spine. Above the ischial spine is a wide notch called the greater sciatic notch, and below the ischial spine is a small notch called the lesser sciatic notch. So, greater sciatic notch and lesser sciatic notch. Here you can see this is the gluteal surface of the ilium, posterior gluteal line, anterior gluteal line, and here comes the inferior gluteal line. This is acetabulum. This is greater sciatic notch, this is ischial spine, and this is lesser sciatic notch, this is ischial tuberosity. So, what is attachment to the ischial tuberosity? Hamstring muscles got attached to the ischial tuberosity. Then the next part is the pubis. Pubis comes anteriorly. Pubis has a body, a superior ramus, and an inferior ramus. So, listen. This is ischium. The whole is ischium having superior ramus, inferior ramus, and an ischial tuberosity, then an ischial spine. But pubis consists of a body, superior ramus, inferior ramus. So the ramus of both ischium and ilium together forms a rounded foramen here, which is called obturator foramen. When the ischial and pubic processes, the superior ramus of the ischium, superior ramus of the pubis, inferior ramus of the ischium and inferior ramus of the pubis together encircle obturator foramen. So this pubic area gives attachment for the adductor muscles of the thigh. Adductor muscles are the muscles of the medial compartment of thigh. Hamstring muscles are muscles of the posterior compartment of thigh, while adductor muscles are present in the adductor compartment of thigh. So these are the different parts with the muscular attachments. Apart from having ilium, ischium and pubis, the other structures present here is the acetabulum, which is a horseshoe shaped structure having a depressed area here. It is filled with fat, acetabular fat, and this is articular surface, which is horseshoe shape, that articulates with the head of the femur to form the hip joint. Now, this greater sciatic notch, lesser sciatic notch, ischial spine. These are the features of the hip bone. Here you can see the ischial tuberosity with the different muscles. These muscles are semimembranosus, semitendinosus, biceps femoris, and adductor part of the hamstring part of the adductor magnus. All these together called the hamstring muscles. So these hamstring muscles are attached to the ischial tuberosity, and this is a picture of the ischial tuberosity. Here you can see the muscular attachments. The posterior gluteal line, anterior gluteal line, inferior gluteal line with the gluteus maximus, medius and minimus. This is acetabulum. Greater sciatic notch, lesser sciatic notch, ischial spine. This is obturator foramen. This is the ischium, body of the pubis, superior ramus of the pubis, inferior ramus of the pubis. This is the iliac crest. This is the muscles which is attached to the hip bone. Here you can see the greater sciatic notch and this is the lesser sciatic notch. Several structures are passing through the greater sciatic notch of the hip bone. And these structures mainly the piriformis muscle, sciatic nerve. Main structures passing through greater sciatic foramina is the piriformis muscle, piriformis muscle, as well as then sciatic nerve. That is why it is called sciatic foramen, greater sciatic foramen. When other structures passing through are the inferior gluteal nerves and vessels, posterior cutaneous nerve of thigh, nerve to the quadratus femoris, nerve to the obturator internus, pudendal nerve, internal pudendal vessels. So the main structure which is passing through the greater sciatic foramina is the piriformis muscle and the sciatic nerve. So this is about the hip bone.